Hello, everyone. I'm Shabana this side, and today let's discuss about absolute uterine factor infertility. It's a very hot topic, and there are two articles on this. One was published in the talk in April 21, and other one is a scientific impact paper that was also published in April 2021. So it's also a very important topic from the examination point of view. So we will also be discussing about the options of fertility available in these women with uterine factor infertility. So we will be discussing about adoption, surrogacy, and uterine transplant also in detail. So absolute uterine factor infertility, it occurs because of absent uterus or dysfunctional uterus, and it affects about 1 in 500 women of childbearing age. So what are the causes of absent uterus? Hysterectomy. And hysterectomy can be done because of obstetric hemorrhage, if there is severe PPH, benign causes like in heavy menstrual bleeding, where the woman is not responding to any medical treatment, or in cases of cancer like cervical cancer. Then there are congenital causes of absent uterus, like in Mayer-Rokitansky-Kuster-Hauser syndrome, complete androgen insensitivity syndrome, and in trans women. What about the causes of dysfunctional uterus? So here uterus is present, but it is dysfunctional, meaning that it is not able to carry and maintain the pregnancy. So this can happen in Asherman syndrome, fibroids, severe adenomyosis, uterine malformation, and pelvic irradiation. So what are the fertility options available in women with absolute uterine factor infertility? So options are adoption, surrogacy, and uterine transplantation. Now, we should know about all these three options because if we get a scenario in the exam, whether it is a simulated patient task where the woman has undergone hysterectomy and she wants to know about her fertility options, or there can be a structured discussion task where the examiner wants to know about the fertility options in women with absolute uterine factor infertility. So let's discuss about adoption first. It is the permanent transfer of parental rights and responsibility from a child's birth parents to adoptive parents. In UK, it's a very lengthy process. So what the process entails, the adoptive parents should first contact the adoption agency, and adoptive parents, they have to undergo evaluation process and many checks to assess their suitability to adopt a child. Also, home visits will be done by social workers. There will be police checks to see that the adoptive parents, they don't have any criminal record. Medical checkups will be done to see that they are medically sound and healthy. And then they will also undergo preparation and debriefing sessions. They will also need at least 3 references. Like this can be from their family members or their friends. Once all the checks and evaluation process is complete, then social workers will submit their report to adoption panel for approval. And the adoption panel will then contact the adoption agency. So if the report is positive and the adoption agency and the adoption panel decides that these parents or this particular person can adopt a child, then there will be the approval process that like the application will be approved. And this whole approval process takes about 6 months. After the approval process, the adoption agency starts looking for a child, and they also ensure that there is a good match and compatibility between adopted child and adopting parents. And this matching process can take 2 years in UK. So we can see that it's a very lengthy and a bit complex process. What are the legal aspects related to adoption? Age of adopted child should be less than 18 years. Age of adopting person should be more than 21 years. And it's not necessary to be a British citizen to adopt a child. However, adopting person must have a permanent home in UK and must have lived in UK for at least 1 year. And the person can be single or married. So this is the adoption process in short. So when the adopting parents decide to adopt a baby, then the inquiry is started. There will be home visits by the social workers. Also, police checks will be done to assess any criminal record. The medical checks will be done, and then the application will be approved. And this application will go through many stages of approval. This will also go to the adoption panel. So the social workers and the police, they will all give their report to the adoption panel. So if there is no criminal record and the parents are found to be suitable, after that, the adoption agency will start looking for a child. So the matching and linking will be done. They will also see whether there is a compatibility between the adopted child and the adopting parents. And once the match is done, then adoption order will be given. Regarding the surrogacy, it is the process whereby a woman who is the surrogate, she carries the pregnancy and gives birth with a pre-arranged plan of giving the child to another person or couple. And these couple, like they are the intended parents. Surrogacy arrangements can be paid or commercial or unpaid or altruistic. So in UK, surrogates are unpaid. There are two types of surrogacy. One is full or straight or traditional surrogacy. In this, surrogate provides her own eggs, so she is genetically related to the child. Then second one is the host or gestational surrogacy. In this, surrogate does not provide her own eggs. She is only the host and she only carries the pregnancy. So the eggs may be provided by the intended parents or by an egg donor. Then what about the legal aspects of surrogacy? Surrogate will be the child's legal mother at birth. And if the surrogate is married, then her husband would be the legal father. Surrogate can then transfer legal parenthood to the intended parents 6 weeks after birth of the child, and this is the parental order. Okay, so here in the picture we can see this is the traditional surrogacy. So in this, the surrogate is the one who is providing eggs. Then there is gestational surrogacy. In this, the surrogate does not provide her eggs. She only carries the gestation. She is only a host. So here the egg is provided by the intended parents or the egg donor. Now let's discuss about uterine transplantation. It's a very hot topic and very important topic from the examination point of view. It entails transplantation of the uterus, including cervix, surrounding ligamentous and connective tissue, and major blood vessels supplying and draining the uterus. Uterine transplant is undertaken when the woman is ready to start a family and is removed after the completion of their family. So once the family is complete, the transplanted uterus is removed. What about the donors? So the donors can be living or deceased. And both the donors and recipients of uterine transplant, they need to be seen by the specialist fertility counselors. Regarding the deceased donors, there is no risk to the donor at all. And highly skilled MDT surgical team is required for operation. Now let's discuss about the potential recipients of uterine transplant. So there are some important points which we should know. Recipient's age should be between 24 to 40 years. Recipient can be 42 years. If egg preservation was done before 38 years of age. And if hysterectomy was done because of cancer in the recipient, then no uterine transplantation is done for 5 years because of risk of recurrence. So there has to be at least 5 years of remission. In Asherman syndrome, hysteroscopic adhesiolysis is done initially. If it fails, then uterine transplantation is considered only for severe cases. In MRK syndrome, the prerequisites for uterine transplant is that there should be normally functioning vagina with a length of 7 centimeters or more. What about the potential donors? There has to be investigations done for them. The investigations are done to screen to prevent transmitted infections like HIV, hepatitis B and C, and the donors are also screened for CMV virus, Epstein-Barr virus, syphilis, toxoplasma, human T-cell lymphotrophic virus. Also, cervical smear or cervical screening is done, HPV testing is done. Tests are done to exclude STIs like chlamydia, gonorrhea, and trichomoniasis. And vaginal culture is done to exclude Candida species and bacterial vaginosis. Also, transvaginal scan is done to exclude structural abnormalities. Magnetic resonance angiography or computed tomography angiography is done to provide information about vessel morphology, caliber, and patency. So these are the prerequisites. The donors, they have to undergo these investigations and the scans and the specialized imaging. Let's discuss about immunosuppressants. So these are given to recipients to prevent graft rejection, and mostly non-teratogenic immunosuppressants are used. Combination of tacrolimus and azathioprine is given. If mycophenolate mofetil is given, then it is replaced by azathioprine in anticipation of embryo transfer, and it should be stopped at least 6 weeks before embryo transfer. Only single embryo transfer is done 6 to 12 months after uterine transplant. And it's going to be a high-risk pregnancy, so the woman will need MDT management, including input from the consultant obstetrician, input from fetal medicine unit, specialist nurse, specialist midwife will be involved in her care, psychologists, counselors, and support group should also be involved. Delivery is done at 37 weeks by cesarean section. If there is no complication, it can be done sooner if indicated. What are the risks of uterine transplantation? There are surgical risks and also risk because of immunosuppressants. So surgical risk is to both the donor and recipient. There will be multiple surgeries in recipient, like uterine transplant surgery, then delivery by cesarean section. If there is graft rejection, then recipient has to undergo emergency hysterectomy. And also hysterectomy is done to remove the graft once family is complete. There are risks of immunosuppressants like diabetes, nephropathy, and rarely there can be development of cancer. After removal of uterine transplant, these immunosuppressants are also stopped. Let's discuss about the fertility considerations. Uterine transplant, it satisfies the personal desire to carry a child and to give birth. Fallopian tubes are usually retrieved during uterine transplantation as part of the graft in order to facilitate uterine manipulation. But they are subsequently removed after implantation to reduce the future risk of ectopic pregnancy. Okay, so this is also an important point that fallopian tubes are removed after the uterine transplantation to reduce the risk of ectopic pregnancy. Another important point is prior to uterine transplantation, the embryos are cryopreserved. So the creation and cryopreservation of embryos is required. Why this is important before uterine transplantation? Because this guarantees the availability of embryos postoperatively, and also it reduces the overall risk of egg collection after uterine transplantation, when anatomy may be distorted, and also there is increased risk of infection with immunosuppressions. Also, with the development of vitrification techniques, that is rapid cooling techniques, success rate of using vitrified or frozen embryos are similar to those with fresh embryos. Unique advantage of uterine transplant over the solid organ transplant is that it is temporary, and once the woman's family is complete, the graft is removed and immunosuppression is stopped. So let's see the steps of uterine transplantation, how it is done. So the first step is that the mother-to-be, the recipient, in her the eggs are extracted and fertilized with her partner's sperm. It means that the embryo preservation has to be done first before the uterine transplantation. Then second step is donated uterus is implanted. And after implantation of the uterus, the woman will receive immunosuppressants. And once the uterus is secure, embryos are implanted. Only single embryo transfer is done. And this is done at least 6 to 12 months after the uterine transplantation. Delivery is by cesarean section at 37 weeks of gestation. Then fourth step is once the family is complete, the uterus is removed and also immunosuppressive medications are stopped. So this algorithm is from the talk. Like if you get a task, simulated patient task, and you have to discuss about the management to like the fertility options in women with uterine factor infertility. So how you will go about it. So in the history, you can ask the woman whether she wants a child who is biologically related to her or not. If she says no, she doesn't want biologically related child, we can offer her adoption and then discuss about the pros and cons of adoption, which I will be discussing in a while. If she wants the child to be biologically related to her, then give her the options of surrogacy or uterine transplantation. And if she wants to carry the baby herself, then give her the option of uterine transplantation. And then you have to discuss about the counseling, the surgical risk, the risk of immunosuppressions. And we also have to assess the suitability. So if she is ready for uterine transplantation, and if she's suitable, then we will proceed with uterine transplantation. But if she's not a suitable candidate for uterine transplantation, or if she's not ready for it in view of the risk of surgery and because of the immunosuppressant medications, then we can offer her surrogacy. Okay. If she wants to know about the advantages and disadvantages of all the three options, because usually when we are offering or discussing options, then we are telling the pros and cons. So this is again from the talk. So in adoption, what are the advantages? The parents, they acquire the social and legal parenthood, and also the parents get the opportunity to enhance the life of a less fortunate child. And it has been generally seen that there is positive outcomes for both the parents and the adopted child. What are the disadvantages? Adoption is a very lengthy process, and sometimes if there is no bonding between the parents and child, then there can be anxiety. It is also a very challenging process. Regarding surrogacy, the advantages are it allows biological relation to child, and the parents obtain the legal parenthood after completion of the parental order. Also, studies have shown positive psychological outcome for the children and the parents. And in future, more than one child can be attained if relationship with surrogate remains positive. So there is possibility of a second sibling as well. What about the disadvantages? There are some ethical, cultural, and religious barriers. And in UK, surrogate is legally recognized as the mother at birth. So this may not be acceptable by some parents. And also there is some risk that the surrogate may not be ready to transfer the parental order. There is another risk that if the child is born with any medical or physical handicap, then the parents will not be ready to adopt the child and they may not agree to the parental order. So in this case, the court's order is very important. Regarding uterine transplant, advantages are it restores the reproductive function and it helps the woman to experience the gestation and childbirth. That is, the woman can carry and give birth to her child. It allows biological relation to child and parents, they automatically become the legal parents of the child. It is also widely accepted, and more than one child can be born. What about the disadvantages? There is very high surgical risk, multiple surgeries are done, and also there is risk because of the immunosuppressive medications. There is risk of failure, there can be graft rejection. Woman has to undergo emergency hysterectomy. And there will be strict selection criteria. And both surrogacy and uterine transplantation, they are very expensive. I hope this was helpful, and please do like and subscribe to my channel. I shall be uploading more videos from the examination point of view. Okay, thank you, and all the best for the upcoming exams.